beyond the basic science to the next level of analysis, which is using imaging to gain insights in vivo and what's going on in human beings. Now, I think the really seminal trial in that regard is EVAPORATE. Now, we've got interim results that have been presented by Dr. Budoff as a late-breaking clinical trial at the American Heart Association in 2019. The results really, I think, were met with great enthusiasm, though I'd like to have Dr. Budoff just provide a recap of what those interim findings were from EVAPORATE.
Yeah, so briefly, EVAPORATE was kind of a mechanistic study to look at the effect of icosapent ethyl potentially on atherosclerosis. We talked about some of the mechanisms, and one of the purported mechanisms or proposed mechanisms is that it might lower atherosclerotic burden. So we did a randomized trial using the same entry criteria as REDUCE-IT, elevated triglycerides. This time they needed to have at least a 20% stenosis in a coronary artery, and we did CT angiography, so a non-invasive way of looking at the coronary anatomy, randomized them to 4 grams of icosapent ethyl or placebo and followed them for 18 months. We did a pre-specified scan at 9 months, and that's the data we have currently to show you. At 9 months, there was a 19% reduction in total non-calcified plaque and a 42% reduction in the rate of progression of total plaque when you compare icosapent ethyl to the placebo group. Both of those were statistically significant. Our primary endpoint of the trial was looking at low attenuation plaque, with this type of vulnerable plaque that we think is important. And there was a 21% reduction in the rate of progression of low attenuation plaque, but that was not significant and not significant enough to stop the trial. So we have now completed the 18-month data. It's embargoed still, so I can't share with you the final results, but I can say now, as of yesterday, that we did present our 9-month data at American Heart Association as a late-breaking clinical trial, and the data will be now published. The manuscript is now accepted at Cardiovascular Research, so it will be coming out fairly soon in publication.
Yeah, very exciting about the interim results, and that was just so the audience understands pre-planned, pre-specified, and the goal, if certain p-values weren't met for the primary endpoint, were to continue onward. So really, I think there'll be many people eagerly awaiting to see what those final results are. I'd say probably one of the most anticipated trials that are out there right now.